Hi, I'm Dave Logan. I'm with Dr. Rhea Pitts, who's a cardiologist at the North Suburban Medical Center. Dr. Pitts, very nice to see you.
Nice to meet you.
So, who is a candidate, unfortunately, for any type of heart disease? What does that person look like?
Well, I think it's important to define heart disease. What does that mean? It's really just an umbrella term, but that does encompass coronary artery disease or blocked arteries, but it also encompasses congestive heart failure or valve disease. So you kind of have to think about, what do you mean by heart disease? Most of the time in the media when we talk about heart disease, it's usually related to coronary artery disease, meaning that it's due to a blocked artery or some sort of abnormality in the coronary arteries. So who's at risk for that? Well, we know that men tend to be at a higher risk than women. We also know that certain risk factors put you at risk for this coronary artery disease or heart disease. And those risk factors are high blood pressure, having diabetes, high cholesterol, poor lifestyle habits, and then also having a strong family history. So if your mom or your dad, brothers or sisters have heart disease, then you might be at risk for it as well.
You know, you always try to live a healthy lifestyle and to exercise and to eat right and do all the things, but really, as you mentioned, the family history unfortunately can sort of override everything, correct?
Unfortunately, at times, but you have to think about heart disease as a perfect storm. So people may have a predisposition to having heart disease, but then on top of that, you may have additional risk factors. You put diabetes on there, high blood pressure, smoking is a really strong risk factor, and then you have this perfect storm for having heart disease. But family history is very important as well.
So when somebody comes into you, I mean, what would bring that person in to see you? What sort of symptoms might they experience?
So the typical symptoms, which usually men manifest more than women, would be kind of this left-sided crushing chest pain. It may move or radiate, we call it, to the arm or to the jaw. And then they may have other symptoms with it. They may feel nauseous with it, may have shortness of breath with it, or a fast heart rate. And that would be very worrisome for a heart type of pain. But we know that women, people with diabetes, and also the elderly folks, they may present with not so typical symptoms. So they may just feel fatigued, or they may just have maybe epigastric or stomach, or I get a lot of heartburn sensation. They just think it's heartburn, and then it just persists. They take Tums, or they take some sort of medication to try to help, and it still persists. And then lo and behold, they go to the emergency room eventually, and it ends up being a heart attack.
From your perspective as a cardiologist, how have you seen sort of how you deal with patients and how you treat patients? How have you seen that change over the years?
Well, I don't have many years, I guess, under my belt yet, but we've seen medications improve outcome or mortality for patients with heart disease. Decades ago when I wasn't practicing, I was still in, elementary school or whatnot, we were still we didn't have the medications that we do nowadays. So now we have more options, and we know these medications work, and we know that they improve your risk for developing another problem in the future. So for example, statin has developed within the last couple of decades, and they've made a dramatic change in the outcome of these patients. So that's a huge change from back then. Other things that have improved is just our technology. So you probably heard of people coming in with stents placed. So back in the 90s, we only had angioplasty, meaning we could just open up a blocked artery with a balloon. But now we're able to put in a stent to keep the artery from closing up again. And you add medications on top of these new technologies, and we do have improvement in patient symptoms and their mortality and their outcome and their risk for another heart event in the future.
So doctor, let's talk a little bit about women and some of the symptoms that they may have with respect to any sort of heart episode.
So they may present differently than a man. They may not have the typical symptoms of left-sided chest pain that's crushing or, going to their arm or their jaw. They may just have epigastric pain or a stomach pain. A lot of my female patients come in with, they felt like it was a heartburn, that just kind of persisted despite whatever they did. So that tends to be a potential symptom. The other thing is they may just feel fatigued. So my elderly female, they just kind of wake up and they don't feel like their usual self. They feel tired, or they just don't feel right. And so it can be as vague as just feeling fatigued. So I think the most important thing is making sure that, you know, people are in tune with how they usually feel, and if something is wrong or they just don't feel right, then to definitely get you know, a doctor's input or seek medical advice and evaluation.
So finally, how does a person know the difference between, hey, I might just be feeling fatigued, as opposed to, hey, there might be something really seriously wrong with me?
That's a very hard question to answer, and you know, I get phone calls all the time, Doc, I don't feel right, and unfortunately there's no way for us to know unless you go in and get evaluated either by your primary care doctor or cardiologist, or if it's that severe, going into the emergency room. So it's really hard to say, but if it's not your usual self and you have risk factors, then it's a good idea to get evaluated.
Nice to meet you, Doctor.
Nice to meet you. Thank you for having me.